Now I would like to ask the Moore-Topazios in whichever way you like to share experiences.
And I'll use the podium as well.
Uh-huh.
But hello and thank you for having us. Our journey, my daughter's journey, what a long, strange trip it's been. One that has taught me the importance of grateful living, being grateful for the care she received, and mostly being grateful for the donor and the donor's family. It's also taught us to live in the moment, because we never know what's going to happen next. Karina's journey began when she was 2 weeks old and she was diagnosed with a congenital heart disorder. This impacted her entire life, and particularly the last 15 years as she grew weaker and sicker and more disabled. She hasn't been able to build an adult, independent life. So while some heart transplant patients have a wonderful life to go back to, she has to build one, which she's going to do now. When we first talked about the heart and liver transplant and Karina was in the hospital, one of the doctors advised me that one of the best things I could do would be to make sure that the heart and the liver team communicated and coordinated her care. I took this responsibility very seriously, which complicated my role at the hospital. One of the most difficult parts, Karina was in the hospital for over 6 months, and one of the most difficult things was every new caregiver, we had to develop communication and build a relationship. And that's every intern, every resident, every fellow, every attending, every phlebotomist, every nurse, every care partner, the respiratory therapist. The list is endless. And it just got to be very exhausting, especially when she was so fragile for so long and needed such intensive care. And when I went to the head nurse and asked about some consistency in her nursing, I was told that some of the nurses didn't want to work with Karina because of me. And I suppose they didn't like it when I told them that the map had to be 65, not 60 for the heart. And when mistakes were made, I had to ask difficult questions. Like when I was sending out an email to loved ones about how Karina was doing, and I asked the resident, just how do I explain the third time a tube accidentally fell out of Karina? This didn't make me popular. I tried to back off until the first time I saw one of the nurses yank off some of Karina's fragile skin along with a bandage. Try watching somebody do that to your loved one and keeping quiet. Those of you here lead her care, and yet it's those who are with her day after day, hour after hour, that really do have a great impact on healing. And at this point, I want to send a shout out to Courtney, who was such a great teammate in ICU at such a difficult time. I don't think she's here, but nonetheless, I appreciated her teamwork. One of the real important parts for me of being there with Karina and helping her through this was communication. Communication with the doctors, and some consistency and gaining confidence in the attending doctors who took care of her, which we did. Thank you all for your time and attention. When we felt like we needed to communicate with you, we were able to do that. Participating in rounds in ICU was very important to me. It just made a big difference. And while I don't know the clinical definition of post-traumatic stress syndrome, I know what I saw. I saw my daughter trapped, and I saw every day somebody came in and did something painful to her, which has to be traumatic stress and has to be addressed in her recovery. I attribute the success of Karina's transplants to love and will and focus. Karina's will, your will, all the goodwill of all the wonderful caregivers she did have, and of course, the goodwill and love that from so many loved ones, far and wide. And the wonderful support from my work. I was able to be with her quite a lot. They were very understanding. All of that just all mattered so much. And again, thank you to all the caregivers who really helped her come through this. And I really, truly want to acknowledge the importance of the Urban Zen program in maintaining Karina's will to endure all of this. From Betty bringing her lavender oil in ICU to the many times Ray came to work with her, it just really helped to integrate her will with her body and her healing. And I find this holistic approach to healing at UCLA just remarkable and the most welcome progress since when I first talked to my psychology professor about it, and he said to me, well, just what is holistic healing? And mostly, I really want to close by my deep appreciation, and I can't list all the doctors like Judge Block did. There were just so many, and the nurses, and the care partners. Just thank you. We're deeply grateful. And of course, most importantly, our sincere gratitude to the donor and the family and our prayers. Thank you.
That's my wife, folks. Karina's mom. And kind of what Dr. Dang was talking about was it's a person there. And what I saw in my daughter was strength and courage that I didn't know existed. Just watching your child go through that and then realizing that as that person given that choice of do we do this and do we do that? Do you want to do this or do you want to do that or do you want to wait for that? And then making that decision, having the courage to make that decision and having the strength to follow through on it. We had the extra challenges of Karina having being an adult with a congenital heart disorder. And it seemed like that was probably the biggest obstacle that we were coming across, and I think what Barbara's even talking about is the fact that a lot of these caregivers, we were seeing people coming in next door on both sides of us, staying for 2 days and then leaving, and we were just there, it seemed endlessly. We saw the little steps going, we saw the steps back happening too. But what we saw was a lot at UCLA that went above and beyond. And it's funny, I didn't read Barbara's presentation, but Nurse Betty, her real name, one night got the lift team, put her in a wheelchair, bundled her up, got a care partner, and Karina's friend Nola, and the four of us went down the special elevator downstairs outside to the fountain. And after being in ICU for a month, the magic of the night, I think, helped give Karina even more of a will to live, because there was something outside the glass and the walls that we have been in so intensely for that amount of time. And what happens when you're there is, we know Dr. Cruz, we know our cardiologist, Albahosen, and Dr. Dang, but the white coats that come in all the time, please don't get upset when we start giving you nicknames. Harold Lloyd, the Russian Mob, Isabella Rossellini, Sarah Silverman, because that's how we tell each other, oh, it was the Russian Mob came in here and he said, we're going to have to do this today. And every family story is different and just as special. And we know how special Karina is. And we talked to Dr. Block. We just happened to meet at one of the clinics while we were leaving, and he was talking about, I feel like I'm younger again, and I can do this again, and I can do that again. And I'm thinking, what a difference. The same procedure from someone who never knew what being in shape is. And now, when she takes a walk and she says, my muscles are sore and I'm tired, it's not because when she's saying before, I've walked up the stairs and I'm tired. There's a big difference there. And we thank all of you for that. And again, I think we always want to keep in mind the donor's family too, because something had to happen for this to happen for Karina. So if you're so inclined in your prayers and cares, to remember them too when you're treating the transplant. One last thing, if you want to, Dr. Dan, get more cheeks and seats, as we say, maybe Heart Success Symposium might be a little better than heart failure. Thank you. God bless you all.
So the question is, anyone else in the family who wants to comment at some time?
I was supposed to give a speech today, but I just sort of realized this situation has been going on my entire life. So it's really hard for me to get it into just a few minutes. My parents actually said a lot of the things I wanted to touch on, and I hadn't read what they had written. But like them, I do want to say thank you for all the care. I know I'm a really unique case, both being a congenital patient and a heart and liver transplant. And it wasn't easy for any of us, I don't think. But May 8th, I celebrated my 1-year anniversary, and I had a celebration last weekend with friends and family. I called it my rebirth day. And getting over or recovering from the transplants is the hardest thing I've ever had to do. I hope it stays the hardest thing I ever have to do. So I guess if there are any questions, I'll take some. Yeah.
Hi, Karina. I'm Tammy. I'm one of the heart failure nurses. I work in cardiomyopathy. What do you wish the team would have told you prior to being transplanted? What were you surprised about after the transplant that you wish you would have been taught or educated about pre? What could the team do better?
The biggest surprise, I think, for us was the bed sores.
They could avoid it.
Yeah, I'm not sure how that could have been avoided or talked about beforehand or even predicted, but I mean, I have a special cushion now because they're technically healed, but I have one of my coccyx that's still really tender. Yeah.
Okay.
And it's just kind of a little cruel, I guess, that after going through all that, the thing that hurts most is my butt.
Okay. Thank you.
Anyone else?
Can I ask Dan and Lee, if you have anything to add, because you have had long-term relationships before Karina was actually even on the waiting list.
I think the challenge with congenital heart disease, from my perspective, I'm not a congenital heart disease expert. I'm a heart failure transplant doc. Lee, I'm not sure if he's still here, is a congenital disease expert and transplant doctor. But from my perspective, it's all about timing, because there's inherent risk with the congenital heart disease population. The upfront risk is high, and we want to wait till we really think that the risk is going to be worth the benefit. And I think that it's a special population, not only because of all the surgeries you've had in the past, but what I've learned in the last several years is that the congenital team here is really, really good at finding out that time, and I put a lot of trust in them and our surgeons to pull that trigger. And really, my view of our role is there to support you, to support them, to help with immune modulation, and to kind of give you a little bit of courage that we've seen it, you'll get through it, and in the end, you'll be stronger. Because after all, in the long term, congenital heart disease patients actually do very, very well if you look at the overall curve. So once you get through that first year, it's really one of the best populations. So I think all I would say is thank you for being here 1 year out, and just reminding us why we're here.
Thank you.
So Karina, happy birthday. Dr. Abelholston really had the privilege of taking care of you for so long before I came into the picture. And I really came into the picture, I think, on the day that we decided that you would go home for a month or two before deciding to come back in the hospital and be enlisted. I think that was a really big decision, and I think it was really sort of important for you to take that time and be ready to come into the hospital and commit yourself to that process. Karina had a fontan that we often describe as a failing fontan, where your physiology no longer was, as favorable to you. And I think that we struggle in the congenital world at determining the right time. And one of the really great benefits that you had with Dr. Abelholston was you had that longitudinal time to really make the decision at the right time. Now, one of the things that maybe you could comment about that would give people insight is just how you feel now that you have 2 ventricles instead of 1. Might kind of an interesting question for people.
Well, I'm still building up my strength, I think. Like Dad said, now when I get tired, it's more from muscle fatigue than from being completely out of breath. So that makes a big difference. And I have been walking my dog just around a couple blocks. So that's been helping, and trying to get out to I love to crochet and knit, and I go to a lot of stitch and bitch groups. And so that's how I sort of socialize, and it's good because it gets me out of the house, gives me something to do. Yeah. I don't know if you guys heard her, but Mom said it's important that I'm getting stronger rather than weaker, and I think that is the progression, even if I'm not completely there yet.
I think also from a provider standpoint, one of the reasons why I chose to go into congenital heart disease, besides the obvious fact that I described during my own speech of having congenital heart disease myself, is that we get to develop these really wonderful relationships with our patients. In the pediatric realm, my patients bring their baseball pictures, their dance pictures, and they kind of grow up with you. And I think one of the things that we know as a team is that when congenital patients get transplanted, they move on to a different sort of care team. And it's really, in some ways, it's like what I was talking about before, the transition from the pediatric to the adult world. And we have to go as well, and it's just really nice because we've seen you a couple times coming in for your transplant visits, and you're just so full of life and so beautiful, and it's just wonderful to see.
Thank you.
Just one other comment. When Dr. Reardon mentioned Karina going back and waiting, and making the decision of what to do. We all remember the day that Karina was in the hospital, and we had, as Dr. Deng puts it, about, I think, 8 or 9 white coats come in the room, and these were all the top of their field, attending doctors, talking to her and telling her she needed a transplant and she needed to check into the hospital and wait for it. And just the impact of that discussion was profound.
The thing that I realized on the day of the white coats was that they were not just there to convince Karina, but they were going to be Karina's team. And I think the amount of knowledge in that room, the amount of passion for healing in that room was through the roof. And I think, and I'm not sure with Karina, but for us, it gave us some comfort to know that this is the team that's behind her. In Dr. Cruz's office, she was told that she was the quarterback. But she wouldn't have made it without that team.
And they were there. They were there the whole way. Thank you.
So thank you.
Well, one of the things that I was really, really glad I got to do was I was allowed patio privileges. And on the weekends, I'd go down on the patio, and my parents would drive the dog up. So I get to spend like an hour or 2 with my puppy. And yeah, she was very clean. But I got to see her on the weekends, and it helped us both, because there have been times when I've gone into the hospital for a week and I come back and she's like, "Oh, happy to see me," for like 5 seconds, and then she's like, "Wait, I'm mad at you." Not that she growls, but you know, she sort of gives me the cold shoulder for a little while. But being able to see her was such great therapy, and her being able to see me, to know that I'm still around, that I haven't just abandoned her, I think helped her out too. Yeah, and UCLA also does have the PAC program, which is the People-Animal Connection. That was fantastic. I loved meeting all those little dogs and big dogs. Made friends with the Great Pyrenees, who was bigger than I was, who just hopped right up onto the bed. It was great. And unfortunately, those had to stop once I got the VRE. But while it lasted, it was great. And even after the VRE, I was able to spend time with my own dog, that was really quite a blessing.
Can I ask one question in this context that is actually to you and Donetta and Mrs. Williams? Would you have wished that you'd have had contact with someone who had gone through the process of the transplantation with a lifelong heart condition while spending the 3 months in the hospital on the waiting list? Or is it something that you did not in that moment want to go into?
No, I definitely think that would have been helpful.
I can answer that because that actually happened to me. I had the experience of 2 people coming by my room who had been transplant patients, and they were both still in the hospital being treated, and I didn't know what to expect. And one thing is, I think I had a great attitude. As to the nurses, I'm an extreme extrovert, and I really require people around me. That's how I build energy. And I was literally never alone. Besides having Kathy and friends and family, those few periods that I didn't have people with me, the nurses and doctors, and people would always just drop by, say hello, talk, oftentimes about trivial things. Well, they weren't trivial to me. Sports was very important. But the point being is that you really spent the time, and I guess somehow you realized I needed people around me, and you filled that gap whenever it occurred, and that was important to me. But on the 2 occasions that I was allowed to have visitors who were transplants, on the first occasion was a young man. He was, I think, in his late 30s, early 40s. We still know him. And he came in, he had just had his transplant about a week before, and he was walking the hallways, and he was allowed to come in because, ironically, the heart he got, the decision was whether he get it or I get it. We both happen to have been O positives. And O positives are, ironically, not a rare blood type, but a rare transplant because there are so many people that require that particular organ or that particular blood type. We're the universal donor, but we're not the universal receiver. So he got it, and I was aware of that. And, you know, he was so young. Brings back a memory. He was so young, and he was married and had children. And I remember sharing this, and I said, give it to him.
It's okay, you can cry and be a girl, huh?
It's the hormones.
I basically rejected that heart. And I ended up getting a gift, by the way, because I was told that probably take me another 6 months, up to 6 months. And I remember Dr. Bass told me that. And those of you who don't know Dr. Hickey, Ann's a different breed altogether. You talked about wearing whites. I'm not sure Ann ever looked like a doctor in her life. But she came in one day and sat on the edge of the bed and just said to me, and this is, by the way, within 2 weeks after this other young man received his heart, and just said, we found a heart for you. And it turned out to be a 21-year-old college athlete who unfortunately had passed away because of an automobile accident. And so I guess I got a gift for waiting too. But then I had another man who came in who was much older, actually older than me. I didn't know there were many people older than me at that time. But it turned out that he had received the heart about 3-4 years before.
No,
He was in for a checkup, but the point is he had already received the heart and been released and come back just for the checkup. And he had told me about his experience. And for him, it was different than the young man. He had had complications, but he sort of told me how he cherished and worshiped every day because he got to spend it with his family. Both of them gave me, they empowered me. I couldn't wait to get that new heart. So, and all I can say is I've been there whenever I can for anybody that needs that kind of experience, to know somebody that has had a heart transplant. Because I'll tell you, for all of you that work every day with patients that require critical care, tremendous care, you sympathize, and to the best degree you can, you empathize. But it takes a transplant patient to really empathize with another transplant patient. Because the one thing that you can't possibly empathize with is the fact that every one of us understand what it means to face death. And that's something that a person that is healthy could never understand.
We appreciate your comments, Judge Block, and you're describing what we'd like to call our peer mentoring program, and we pair patients who have received a transplant with those who have received a transplant with those who are going to get a transplant. And I agree that there's nothing that those of us who are healthcare providers can say to a patient that would help in the way that you who have experienced this can. So we have peer mentoring, we have pairing, and we also have our transplant support groups where we encourage patients to speak to one another in their experiences. I'd like to tell you also about something that happened last week that I thought was quite beautiful. There was a patient who came to visit. She's a post-transplant heart patient, and she came to visit a pre-transplant female patient, and she actually looked gorgeous. We'll call her patient J. She was just beautiful, just radiant. Her skin, her eyes were clear, and her husband accompanied her, and he said, "I've got my wife back. She's just beautiful." And he had been through so much with her, and I had observed that when she was a pre-patient. So she came to visit, we'll say patient K, a young woman, 22 years old, seated in her room, very emaciated looking, very weak, and with fear in her eyes, I would say, quite naturally. And she just sat still, and her parents were nearby as well. And so the post-patient came, patient J, and sat down with her, patient K, who was seated with her head down, and she was rather still and quiet. And patient J came and sat down and took her hand and smiled at her and said, "I'm here to talk with you about getting a transplant." And they began to talk, and they asked questions, shared what they were feeling, and it became an intimate conversation. We, of course, left the room. But I could see that this young patient who was waiting for a transplant was feeling hopeful, encouraged. Her body language changed. She sat up in the chair. She made eye contact, and it was just beautiful to see. And I think that something like this, while in describing it might seem a minor event, was really very important, I think, to this pre-transplant patient. So we thank you very much, all of you, for sharing your experiences, and we encourage you to attend our groups so that you can share these experiences with the pre-patients. Thank you.